Treat MRSA. MRSA, or methicillin-resistant staphylococcus aureus, is a rather frightening antibiotic-resistant bacteria. About 1/3 of the general population are carriers, that is, they have MRSA bacteria on or in their body but show no symptoms of the infections. Get a diagnosis. Before you are able to treat MRSA, you must make sure that you are infected. Although there are some common symptoms, such as boils, abscesses, septic wounds, and infections accompanied by fever, you should get tested by the hospital laboratory to make sure that the treatment is appropriate. Ask your doctor about antibiotics. Although MRSA is said to be antibiotic resistant, it does actually respond to some antibiotics, just not conventional ones. Your doctor may prescribe Teicoplanin or Vancomycin. Prepare for 4 antibiotics. The most effective way to treat MRSA is usually to receive the antibiotics intravenously, not orally. This means you will likely have an 4. Know that MRSA can reside in the nose. It may sound strange, but the MRSA bacteria can live quite happily inside the human nose. To treat MRSA in the nose, an antibiotic cream is usually used. Treat the skin. Again, because MRSA can be very difficult to treat, many doctors prescribe antibiotic powders, soaps, and shampoos, so that the bacteria on the skin can be fought. Check into alternative treatments. Some people claim that active unpasteurized honey can be used to treat MRSA. Others say that allecin can be useful. There is still much debate over these natural alternatives, with some experts pointing out that they have not been proven effective and others claiming that they are not only effective, but do not cause antibiotic resistance. Get a second opinion, or even a third opinion, if necessary. Remember that there is still a lot of ongoing research about MRSA and not all physicians are entirely sure how to treat it. As with many infections and other medical conditions, your chances for a full recovery are much better when MRSA is treated immediately. If you think you may have an infection, get to the doctor as quickly as possible, as it is always better to be safe than sorry. Lastly, preventing MRSA before infection is the best possible strategy.